So James, no major surprises. The MRI was accurate. So you can see here's a bicep going in. A little bit of inflammation there, but see there's a little tear. If you notice when I pull on a probe, it's lifting up. So that probably would not hurt you for normal activity, but any vigorous kind of sport, this is where you're going to feel it, probably particularly serving. What we do is we roughen up the surface, we pass suture around it, make a little drill hole, and then it's anchored in and reattached. Okay?
Amazing.
So because of this, you can't do this, or you certainly cannot externally rotate. So that's why you're in a sling, but you can do this. As expected, no arthritic change, no loss of cartilage. Wish my shoulder looked as good. I had both of mine scoped, but really it's just going to be in a sling for about 3 weeks.
Okay. But I can't activate myself.
No.
There. I'll have to lift.
Yeah, let her just take your arm and just put it there. That's all.
Okay.
If you don't do anything vigorous, it's not going to go anywhere. But we want it to scar down and heal, so you really want to minimize the motion.
Okay, sure.
You should have you might have a little pain tonight, more likely tomorrow, because the block should last. Don't be freaked out that your arm, you don't feel it, it feels like wood. That's good, because when you start feeling it, you'll feel a little pain.
Okay.
But it shouldn't be anything terrible.
Okay.
Okay?
All right.
That answer all your questions?
It does. Thank you so much.
You're welcome.
James is a professional tennis player from Australia who had his shoulder and wrist repaired via arthroscopy, also known as keyhole surgery. For more information, visit our website.